Months ago, Florida educational leaders announced that public schools would no longer participate in a federal youth survey because the state felt its questions were sexualized.
So investigative reporter Katie LaGrone tonight has a copy of the new survey that Florida has created to now replace it. She reveals what the new youth survey includes and what it doesn't. Well, there are concerns that it might be missing the mark.
Guns, gender identity, drugs, sex. These are among the hot-button politically charged topics in Florida you largely won't see on the state's new voluntary health survey for teens.
Instead, they asked questions that had to do with character and had to do with decision making.
Christy DiVagelli is a Lee County parent and parents' rights advocate.
I didn't see my name, Christy DiVagelli.
She's also among 14 people chosen to be part of a state work group created to help develop Florida's new youth survey.
I'm not really that sure if I want you guys asking my kid questions about anything that has to do with sexual health.
Created earlier this year, the survey replaces the CDC's Youth Risk Behavior Survey, a voluntary student questionnaire long used to chart and compare risky behaviors among U.S. teens. In 2021, for example, results from the survey revealed teen girls in the U.S. are experiencing record high levels of violence, poor mental health, and suicide risk. But last year, Florida's education boss deemed the federal survey inflammatory and sexualized, and all but ordered Florida school districts to stop using it.
There were questions about sexual orientation. There were questions about sexual promiscuity. I mean, there are all sorts of questions that, in my opinion, as a parent, are best left for parents to have those conversations with their kids.
So with the help of researchers from USF, the state put together its own. We obtained a copy. In it, 23 topics, 223 questions. Nearly 3/4 of them focused on the state's new resiliency standards, which is part of required instruction in Florida. Empathy, perseverance, grit, gratitude, even citizenship, just to name a few. But when it comes to the riskiest behavior among teens, Florida's survey doesn't go very far. Just 3 questions address sexual behavior and focus on abstinence, while no questions touch on hard drug use, sexual violence, or campus violence. Caitlin Klibben is with Disability Rights Florida and also part of the state survey work group. She tells us members had little input and didn't see the questions until shortly before the state distributed the survey to select high schools. Details about how the state created this student survey aren't completely clear. Despite multiple records requests by us and our attorneys, Florida's Education Department has yet to provide us with all the documents related to the survey's creation and its distribution. Dr. Sandra Chafulius is a professor in educational psychology for the NEAG School of Education at the University of Connecticut. She's not involved in Florida's survey or the CDC's, but she spent her career studying and creating youth assessments. We asked her to review Florida's new survey for its strengths and weaknesses.
It doesn't allow us now to do this national comparison, so we're going to lose the ability in many ways to track how Florida is doing in comparison to other states, which is an important indicator of the health of the citizens of your state.
This survey is voluntary. Parents, of course, can opt their kids out of taking it. We do know it has been distributed to high school students in select school districts, but we don't know which ones. The state has yet to provide us with those details. However, they do tell us results are expected to be published sometime this summer. I'm Katie LaGrone for the Florida 24 Network.